Great. Good morning, everyone. Thank you so much for being here with us today. My name is Meg Fitzgerald, and I am proud to be here on behalf of Protect Our Care New York, a healthcare advocacy organization. We organize around the state to hold our elected officials accountable for ensuring quality, affordable healthcare is a right that is guaranteed to all New Yorkers. But today, that right is under attack. The Republican Party officially named Donald Trump its presidential nominee this week, despite Trump and MAGA Republicans' repeated calls to repeal the Affordable Care Act, dismantle reproductive care, hike premiums, slash Medicare and Medicaid, reverse recent coverage gains, and raise prescription drug costs for tens of millions of Americans. Long Island House Republicans Nick LaLotta and Anthony D'Esposito continue to back these plans without blinking an eye. If they get their way, prescription drug costs will skyrocket, healthcare costs will go through the roof, and New Yorkers will not receive the quality care they deserve, leading to more dangerous health outcomes. The impact of the Affordable Care Act cannot be understated. Thanks to the ACA, over 900,000 New Yorkers have gained health coverage. Thanks to the ACA, insurers have to cover essential health benefits like maternal care, prescription drugs, and mental health. Thanks to the ACA, the 8.6 million New Yorkers with pre-existing health conditions cannot be denied coverage by insurance providers. This comprehensive coverage ensures that individuals receive the quality care they need without financial barriers. And yet, the Republican Party continues to double down on their plans to repeal the Affordable Care Act at a time when more people than ever rely on protections under the ACA than ever before. This is a dangerous gamble that puts the health and well-being of Americans at risk. Today, I am proud to be joined by elected officials, advocates, and healthcare workers that are working every day to protect the quality, affordable, life-saving care guaranteed to New Yorkers under the Affordable Care Act. First, I am pleased to welcome Claire Leone, a nursing assistant at Northwell Valley Stream and a member of 1199 SEIU. Thank you for being here.
Good morning, everybody. My name is Claire Leon. I live in Valley Stream for 17 years. I am an MA at a nursing home hospital in Long Island. I've been in a nursing home hospital over 17 years. But I've been a healthcare worker for over 16 years. During that time, I have been seeing many folks who are uninsured or undersure, especially before we had the Affordable Care Act. Before the Affordable Care Act, we will see many patients with pre-existing conditions like cardiac, diabetes, who put off care because they could not access affordable health care. Hardworking Long Island residents who could not get health care insurance because they had no insurance or no funds. Patients wait until pain was unbearable to seek help. The lack of healthcare insurance was not only life threatening, but would also bank robbing. Hardworking family just trying to survive. But thanks to the Affordable Care Act, things have improved in our communities. Things are not perfect, but they are much better. So many people here in Long Island have low or no insurance costs and improved healthcare outcome, including folks with pre-existing condition. I want to see the Affordable Care Act expand and make even more affordable care for New Yorkers. But instead, for working for the low insurance costs for our neighbors, some radical member of Congress want to destroy the gain we have made. The Republican wants to kick millions of hardworking Americans and our senior and several children of Medicaid. They want to allow for profit company to refuse to cover people or charge you more if you have pre-existing condition. That's wrong. I love caring for people. That's what I do. I've been a healthcare worker for years. I'm not gonna stand here and then see the Republican try to strip healthcare away from our friend or family or neighbor. Right here in Long Island, we need more affordable healthcare, not less. Thank you.
Thank you, Claire. And now I'm pleased to welcome Assemblymember Solages, who represents the 22nd District here on Long Island.
Hi, greetings everyone. I'd like to thank the Protect Our Care Coalition as well as our healthcare workers. Claire, thank you so much. Please just give her a round of applause because we thank our healthcare workers. Every day they're on the front line, and irrespective of insurance companies or big business, they are ensuring that patients get quality care. And that's what every New Yorker deserves, quality care. And that's what every American deserves, quality of care. We saw that the Affordable Care Act was implemented, and so many individuals were given access to health care. Those who had pre-existing conditions, those who are on the margins of poverty, they were given access to health care. And that's what it's supposed to be about. That's what our government's supposed to be about, ensuring that we are protecting the most vulnerable. Unfortunately, there are federal leaders who don't believe in that. They believe that there should be big business, that healthcare should be a business and not about caring for individuals. And so we are raising the alarm today to ensure that we know that all New Yorkers are advocating for affordable care for our individuals. We've seen many different reforms come out, whether it's the Inflation Reduction Act that lowered drug prices, that ensured that people have eliminated co-pays for insulin. It ensured that there was a paid medical leave and maternal health for expecting mothers. In New York State, we made large steps in expanding care. 7 million New Yorkers are benefiting from Medicaid expansion. We are a model for other states in this country. But unfortunately, again, we see attacks on the federal level to New York's progress. And we have to push back. We have to ensure that we're using our voice to say that every person deserves health care. And so we know that the cost of healthcare is going up, as with everything else because of inflation. And there's an immense pressure on families. But reforms like the ACA and IRA are making healthcare affordable. And we need to ensure that we are meeting these economic challenges with the ACA and the IRA and other safety net programs. And so it's all about closing these health disparities. And so I'm calling on all New Yorkers to be loud and to be proud, to reach out to their federal representatives, to reach out to their state representatives, and saying that we need to have access to healthcare. And I'm going to end on this story. I've had a constituent in my district. We are diametrically different, in policy and politics. We are on different spectrums. But one day he came up to me and he said, healthcare is not affordable. He had a heart attack and was in the hospital, and his wife unfortunately had a respiratory illness and landed in the hospital. And then his younger son was playing sports, and unfortunately he discovered that he had a heart condition and he had to go to the hospital. He said that at the end of that whole, it happened in 1 year, he was so broke that he had to ask his mother and father for money. And they were, if he was he's 65, about 65, 70. And so imagine he had to ask his elderly parents for money because he was going into such medical debt. And this is not an unusual story for New Yorkers, for Americans, because so many suffer from medical debt. So we need to rise to the challenge, and we need to make sure that we're making America more affordable, especially with healthcare. Because at the end of the day, from birth to the end, one individual is going to need the healthcare system, so we need to make sure that they have access to affordable healthcare. So with that, I thank the coalition again. I thank all the healthcare workers for being here and advocating, and I look forward to really making sure that we have affordable healthcare in New York and across this country.
Thank you so much. I can only imagine how many stories like that you've heard in your district. Well, thank you. That's all for today. We appreciate your commitment and dedication to making New Yorkers' healthcare an affordable and quality and guaranteed right.